We really appreciate the partnership with United Healthcare and Premier, and we're super excited to present some updates on the Medicare supplement with AARP United Healthcare. And we'll let you take it away when you're ready.
Sounds good. Thank you guys for allowing me the time today. My name is Greg Abel. I'm one of the account managers with United Healthcare. I work specifically with the AARP Medicare Supplement plans. I support the regional growth directors, Rebecca Mest, which is the one that works with a lot of our NMA partners, but also all of the growth directors across the United States as well. So thank you again for the time. I'm going to go pretty quick here as we're trying to get through everything because I want to make sure I am conscious of the time you guys are committing, so I appreciate that. If anything's too fast and you have any questions, I believe we have a chat option. Please feel free to put them in the chat, and if I can't get to them during the presentation, I'll try to get them back to you as quickly as I can after the fact. But like was said, I am here basically to share some supplement updates. Also want to talk through our dental vision and hearing program, as well as just some new product offerings that we have out there in the market. Just want to make sure that you guys are hearing the latest and the greatest from us directly. So with that, we will jump in and get started. All right. The first slide I just wanted to share here, more just a resource slide more than anything, but you'll see this is our Medicare supplement sales team. So we have all of our regional growth directors listed here. In the West, we have Jamie, Ange, and Sydney. And then in the East, we have Kaiser, Tina, Claire, and Claire II. We have two different Claires there. You'll see that each of the rings that are around their picture coincide with their specific area that they support. And then down below at the bottom of the map, you'll see we have Rebecca Mest, who, as I mentioned, is our National Director of AARP Medicare Supplement Growth. And she really works directly with a lot of our NMA partners, and also kind of fills in across the nation wherever is needed from our other growth directors as well. You'll see that each of these have their email listed below. So if there's any questions or any concerns that you guys have when you're out in the field, please feel free to reach out. These are their direct emails, and they'd be happy to answer any of your questions. All right, just wanted to kind of start super high level and talk about the value of the Medicare supplement plans. So the value of a Medicare supplement plan, for those of you that maybe don't know, or just to kind of refresh, is that there's really a plan to fit every budget and every need. And the really cool thing about the AARP Medicare supplement plans and Medicare supplement plans in general is that, you know, you can really go to wherever you want to get your healthcare and wherever you want to get treatment. There's no need to worry about networks. There's no need to worry about referrals. So the members can really choose and kind of are in the driver's seat as far as where they get their healthcare from and where they want to go to get that treatment. The cool thing about Medicare supplement plans is that they can really go anywhere. So for those folks that may be snowbirds, or if there's folks that maybe travel a lot and want to make sure that their coverage travels with them, these AARP Medicare supplement plans are a great option. Another thing to mention too is that our Medicare supplement plans are guaranteed renewable, which means that members will have lifetime coverage with us as long as their premiums are paid. Which again is just a peace of mind. There's nothing they have to look at. There's nothing they have to review annually. They can basically set it and forget it, which is a fantastic peace of mind for our members. All right, so why AARP Medicare supplements? So AARP Medicare supplements not only obviously have the brand of the United Healthcare behind them, but they also are the only product in the marketplace that is partnering and has the AARP brand on there as well. So two powerful brands kind of coming together to support that product. And because of that, we have a fantastic persistency. Our persistency is average of 10 years, which means that once folks kind of come in with us, they typically like to stay with us. 94% of our insured members currently renew their AARP Medicare supplement plan. And the best part of that is 95% of those insured members that were surveyed are satisfied with their plan that they have. That is not only good for them, obviously, because they're happy with the plan that they have, but that's also good for our agents because typically happy clients talk to other people about their products. So if they had a doctor's appointment or procedure or went to see a specialist and they were like, hey, I didn't have to pay anything out of pocket or everything was covered, their next question might be, oh, well, hey, how can I get enrolled in something like that? Or where can I get something like that? Which then word of mouth gives you those referrals as well, which is really fantastic. And then choice. The AARP Medicare supplement plans has a full plan array that is out there and available for you guys. And the cool thing is, we'll talk through in the additional slides coming forward here about some of the services and the value adds and programs that they can add on to their AARP Medicare Supplement plan that, one, will make them even more stickier for that persistency, but also hopefully will help them just be further satisfied with the healthcare plans that they have available to them. I just wanted to share as well too the top 10 market share by enrollment. So United Healthcare AARP Medicare Supplement plans have over 31% of the market share, with more than 50 years of experience, and with our awesome persistency that we talked about. United Healthcare covers more people with more Medicare Supplement plans nationwide than any other individual insurance carrier, as you can see on the slide, which is, again, fantastic for that brand recognition, but it's also for that large book of business and that stability that comes along with that as well. All right, I wanted to look at our national plan offering map for the AARP Medicare Supplement plans. For those of you who may not be familiar, we really have the two different offerings. We have our traditional United Healthcare Insurance Company plans, which is basically, you'll see all of the white states, and those are, and the blue states, sorry, the dark blue states and the white states. Those are the original Medicare Supplement plans that we've had since inception. Those are the ones that will include all of our value-added services, all of those wellness extras, including the gym membership. Those are the original plans that we started offering when we offered Medicare Supplement plans. But we also, as another option that you can offer your clients, have our UHICA products, which is the white states and also North Dakota. And we'll talk about North Dakota in a second. But basically for the UHICA plans, it maybe is those clients that, still want that brand with the AARP United Healthcare. They still want that the same level of satisfaction, the same level of service, but maybe they're not interested in those value-added services. Maybe they don't want those wellness extras. Maybe they don't want the gym membership. Maybe they're just looking for that cheaper price point. And those UHICA plans offer just that. They offer you the ability to offer options to your clients, what they feel best fits their needs. And this map just really shows what we have available in what states. I do want to call out North Dakota, since obviously it is highlighted differently. North Dakota was one of the first states that we rolled out the UHICA product in, and it actually is the only state in which we just have the UHICA product only. Because of that, it does have a few caveats, like it still does include the gym membership and things like that. We'll talk through that in the future. But you'll notice North Dakota is typically called out separately, and that is why. It's one of the only states that we have just the UHICA product. All right, just wanted to look at a plan overview as well. So this slide specifically talks about our UHIC products, which, like I mentioned, are our original allotment of products that we started with, and just kind of lists the plans that we offer from the least comprehensive, which would be your plan A, up to your most comprehensive, which is your plan G for most members. We do still offer plan F and plan C for those that were first eligible for Medicare before the year 2020. So we still do have those products available. They are still being sold, but just wanted to highlight that as well. But for most people, it's between the A and the G that we offer. Again, spanning from least to most comprehensive. Your plan G is really going to be your Cadillac plan at the moment. It covers pretty much everything except your Part B deductible. And we do have a nice add-on we can talk about in a couple slides coming up here that really shows how we can fill that void as well. But just wanted to highlight kind of what plans we offer. I also just wanted to highlight as well, if you're not familiar, maybe taking a deeper dive in the future, looking at the K&L plans. The K&L plans are a really great option for someone that is maybe looking for that lower premium and is comfortable having that cost sharing with that out of pocket. So you can see that those two plans have a larger annual out of pocket because all of the cost is really shared with them at either a 50% or a 75% split. But because of that, then they get that much lower premium. So it's definitely a great option if you have someone that maybe is looking for a lower price point, still wants a med sup plan, but is comfortable with maybe a little more out of pocket. Those plans are great options as well. All right, and then I wanted to talk about our newest released plan. So we have our new high deductible plan G, which launched in April for June 1st effective dates in the state of Florida. So we're starting with just the state of Florida only, but this plan is a fantastic option. Again, for someone that's looking for that lower premium option, it has the same Plan G structure. The only difference is they have that higher deductible. So they have an annual deductible they have to meet before everything is covered for them in a typical Plan G sense. The really great thing about this offering is that it also includes the Renew Active, which is our gym membership. So you get all of the wellness extras and you get that gym membership at that much lower premium for the regular Plan G. And you have that out of pocket. Once you meet that out of pocket deductible, you have that same Plan G. So this is a really great option. Again, when we talk about the amount of plans that we have that you can kind of put in front of your clients, this is just another option that you can use in the state of Florida to show your clients if that's something they may be interested in. An additional thing that I wanted to just touch on here for the high deductible plan G in the state of Florida is a 2-year grace period. So this is something that we're offering, and you can definitely get more information on this, but I'll just highlight it just so that you guys have an understanding. Basically, if you're enrolling a new client in a high deductible plan G, their first time with us, and they try that plan and decide within 2 years that, you know what, maybe the high deductible plan G is not for me and I want to go to a regular plan G, we will allow them to go to a full regular plan G with no underwriting restrictions, as long as it's their first time enrolling and it's within that 2 years since they enrolled. So I think this is a really great option for someone that maybe wants to try this plan, see if it fits, and then kind of go from there and see if it's something they want to stick with or not. And so this is something, again, that you can talk to your clients about and maybe give them that option if they want to try it. Another thing that I wanted to talk to you about, so when I talked about the plan selections that we offered, and I talked about Plan G and how the only thing you have to pay is that Part B deductible, right? So we rolled out a program called the Easy Claim Pay program. And basically what this is, it's available to AARP Medicare Supplement Plan members at no cost that are enrolled in the Plan G. And it just solidifies that set it and forget it mentality, because basically what it does is when they enroll in this program, they basically are allowing United Healthcare to pull those Part B claims as they come in directly from their bank account so that the member doesn't have to get involved with any of the paying of the Part B deductible. When we get the claim in, we process the claim and we see, oh, there's $20 towards the Part B deductible. We'll notify the member and we will directly withdraw that $20 from their bank account and pay that on their behalf. That is one less bill that they have to receive, one less check that they have to write, and we can set that up and do that all for them. So again, just another option that you can put in front of your clients and say, hey, this is something that AARP United Healthcare has that is unique and really gives you that more of a Plan F feel in a Plan G. So if members are interested in enrolling, new members will typically get an enrollment form with their welcome kit if they're interested. Otherwise, they can definitely give us a call at our 1-800 number and we would be happy to get them enrolled in the plan. I wanted to just show real quick, it is not available in all states yet. This is typically one of our newer programs that we released, and we're trying to expand it very aggressively because it is a fantastic program. We're seeing a lot of utilization in it. But basically the teal states that you see on your screen are the states that we are offering currently the Easy Claim Pay program. And like I said, we are really trying to get this expanded nationwide. But at the moment, this is where we're sitting. So keep an eye out for future communications on any expansions, but this is the states that have the availability to enroll at this moment. And I just wanted to share this. This is some feedback that we've heard on the Easy Claim Pay program since we've rolled it out. It's been out there actually from its first inception. It's about 2 years old, but that was a small handful of states that we started in. And like I said, we've been expanding since. But since we started this program, we've actually paid out over $5 million in Part B deductible claims directly to providers. So when you think about that, that's $5 million in checks that the members haven't had to write. That's $5 million in calls that they possibly haven't had to make, questioning why they're getting a bill, what it's for, just taking that guesswork out of the member and hopefully increasing their plan satisfaction. So you can see on the screen here some of the feedback that we've heard. 9 out of 10 members would recommend and say that it was easy to enroll in the Easy Claim Pay program. 8 out of 10 think that the Easy Claim Pay service makes paying the Part B deductible hassle-free, which is fantastic. 74% feel that the Easy Claim Pay program has a positive impact on their satisfaction with the AARP Medicare Supplement plan. And the majority of members surveyed are likely to continue their service in the Easy Claim Pay program. So all of these things really point to, again, hopefully creating a client that is stickier, that is happier with their program, and that's likely to stay where they are, which is less work for you guys. All right, and as promised, I wanted to talk about our dental vision hearing plans. So United Healthcare's new dental vision hearing, we call them DVH plans, are basically bundled dental vision and hearing coverage that can be sold either at the same time as an AARP Medicare Supplement plan, or they can sell it separately. The good thing is it is sold exclusively through agents like you guys. This isn't available at any other channel except through agents. And it is an easy add-on with the lien process. You can literally add it in your cart with lien, and it's a very easy enrollment. There's also no additional certification that is needed to sell these plans, so it's very cool. You'll see the states that it's offered in on the screen here. So again, this is another one of those programs that we've been trying to expand very aggressively. We actually launched the DVH plans first back in September of 2023 in just a handful of states. And then we've been expanding as quickly as we can. The only caveat that I want to call out when you're looking at the state coverage is really the state of Ohio. The state of Ohio does not have a hearing benefit. So when you're looking at the full DVH package, dental vision and hearing, Ohio does not have the hearing piece. That's the only caveat I just wanted to call out of that. The cool thing about our DVH plans is that they offer different levels of coverage, which we'll look at in just a second. They also offer no wait for most services, so there's no waiting periods. And we have tons of different plans, again, trying to fit what your client is looking for. All right, so I just wanted to highlight here, and we'll go through the dental, the vision, and the hearing, just so you guys can kind of get like a high-level overview of what exactly the plan covers. But this is the dental offerings that we have available. So you'll see there's 4 different plan offerings. The numerical value that is in the plan name really corresponds with the maximum amount the plan will pay out per calendar year. So when you have your 500, your 1,000, your 2,000, your 3,000, those are the respective amounts that they'll pay, which is shown in the chart here as well under that dental calendar year maximum. But you'll see again, the dental waiting periods, there is none of those except in the case of implants in that 3,000 plan. There's no deductible. And you can see all the coverage that it has at those different levels, which is something that you can put in front of your client and kind of see what fits best for them. This just kind of highlights the vision plan. The vision plans, again, these are all a bundled package, so it's not like you can order just the vision or just the hearing. It is full dental vision and hearing. They're all bundled together. But for the vision coverage, this vision coverage is the exact same regardless of which coverage you pick in the dental. So if you pick the 300 or the 3,000, makes no difference. You get the same vision coverage regardless. So vision eye exams, eyewear, there's no waiting periods. There's $175 allowance per person towards eyewear every 2 years for an in-network provider. Members can go out of network as well, but they will receive lesser benefits. And the vision benefits are not included in the dental calendar year max. So when you look back at that prior slide and you look at those maxes, the vision has nothing to do with those maxes. It is a separate piece for the vision. All right, the next slide here, the hearing benefits. Again, just a caveat, Ohio does not have the hearing benefits, so just wanted to call that out again. But basically for hearing, your clients would have access to over 7,300 credentialed hearing providers for hearing tests, hearing aid evaluations, follow-up support, anything they need there. They would include the $750 total allowance per person for hearing aids every 2 years. And there is a full list of providers, but they have to use an in-network provider for these. They cannot go out of network for the hearing benefit specifically. All right, I'm going to jump now to just highlighting some of the things that we've changed recently. You guys probably may have noticed some of these. We've sent out a lot of communications about these updates we've made. You also may just have noticed them when you're in Jarvis, kind of moving around the different capabilities that are out there. But I just wanted to highlight some of the things that we have, just in case you haven't seen them, just to know that they're available and they're out there for you. And hopefully that they'll make everything easier for you and easier to access things for your clients. So one of the upgrades that we did is the letter history. And basically what that means is that you as the agent can now go in and you can view many of the letters that were sent to your client as long as they don't include sensitive information. So this includes enrollment letters, billing letters, and underwriting letters that you can actually go in and view an exact copy of what those letters that were sent to the client. And especially in the enrollment process, if there's something maybe that we're waiting on before we can process that application, it'll show you what we sent the member, what we're requesting, and that way if you wanted to help the member get that information or if you had that information, you can submit that on behalf of the client, which is another cool feature. We've actually added the ability to upload information into Jarvis, but you can do that for the client and help them kind of move the process along, which hopefully, again, makes things more streamlined and easier to do business with. Um, we also have our book of business feature, which we'll look at in depth in a couple more slides coming up here. But the book of business really highlights, obviously for any clients that you've written, you can see the full, your full book of business, but you can also see, by demographic informations, their premiums. If they're delinquent on their premiums, it'll notify you of that. It just a ton of information so that when you go in, you can get a full look of what is out there for your clients and what may be going on with them. Again, if they're delinquent, if they're missing information, if there's letters that were sent, you can view all that information. And then we're also continuing to upgrade our member servicing functionality in Jarvis as well. So like I mentioned, the ability to upload documents is one of the biggest. I know that's been an ask for quite some time, and we have now included that capability in Jarvis that you can upload certain documents, but you can also go in and make certain updates on behalf of your client. We'll go through in just a minute some of the things that you can actually update on behalf of your client now through Jarvis, which saves them an extra phone call and hopefully makes things quicker and easier. All right, so the first thing I just wanted to look at here with you guys is the letter history. So these are the enrollment letters. So when you log into Jarvis and to the enrollment letter, you'll see here the applicant letter history, and you just literally click on the letter that you want to see, and it'll pull up for you exactly what was sent to the member, so you can see what was needed and what you may need to help the client with, or if it's nothing at all that you need to do necessarily, but maybe something that you can let the client know, that's just an option as well. But basically the transparency to see all this information. Again, our underwriting letters as well. The only caveat with the underwriting letters is that as long as there is not sensitive conditions listed, you will be able to view the underwriting letters as well. So if it's something where the client is maybe rated up, or if the client got denied, or whatever the case may be, or if we're looking to contact the client or trying to get medical records, you'll be able to view all that information in these letters. So the same as the prior screen, you go under the applicant letter history, click on the letter you're trying to look at, and it'll pull up exactly what the client was sent so that you can see that and kind of walk through that with the client, or at least have an understanding for yourself. The same thing with the billing letters. So if you have a client that maybe is falling delinquent and they're sent a billing letter, or if they change bank accounts and forget to update that with us, and we send them a letter that they're behind on that EFT didn't pull, you'll be able to go in and actually view that letter, click on the letter, and you can view exactly what we sent them. And like I said, contact the client, or some of these things you can even do directly for the client through the new Jarvis servicing abilities. All right, so these are just a couple of the things that I mentioned earlier that you can do through the book of business. So these tasks, and this is just 6 that we picked out that are typically our highest volume, but there is many more that you can do. But these are tasks that you can perform in Jarvis in the book of business for all of your existing clients. So you can change their address, you can terminate their plan, change or add their EFT, update their phone number, correct how information is displaying, and or change their Medicare information. There are many other options as well, but these are just really the top ones that we see that you're able to now do through the book of business. And then for your pending applications, so if you have applications that you've submitted and that are pending, these are some of the servicing tasks that you can do through Jarvis for those applicants as well. So you can provide missing information documents, you can withdraw a pending application, you can change a requested effective date, you can do a plan selection change for a pending application. If there's missing replacement notice, you can provide that. Provide missing Part A or Part B effective dates. And if any of these require additional documentation, you're able to upload that as well in Jarvis, which is, again, hopefully a time saver that you can just do that electronically now versus having to send it in. All right, the next piece I wanted to touch on is our new personalized billing that we just rolled out. So this is actually brand new. And the reason I bring this up is, again, I want you to understand if you have current clients or if you're enrolling clients, kind of what they may see when they get those billing letters, but also understand some of the perks that come along with this new program as well. So one of the things that really is probably the most impactful is the new rate letters, the new rate notification letters. So if you guys have been around for a while, there has been in the past some clients that are confused by our rate letters because you'll see on the front it'll list, one rate, and then you flip it over on the back and it'll show your rate breakdown with all the different discounts that they may be eligible for, and then it'll show another premium there. And so there was some clients that were confused with, what is the actual amount that I have to pay? I understand I'm getting all these discounts, but there's two different amounts. What am I supposed to pay? What is the amount that I'm going to be billed, etc. So these new letters really simplify that. And there's a screenshot here that kind of breaks it down, and it's one spot in the letter, and it includes the base premium, all of their discounts that they may be eligible for that's applied to their plan, and then the amount that they're actually going to be billed for. Which again, hopefully is just more transparent and more straightforward so that they have less questions. Another upgrade with this new billing system is that there will be no more coupon books. So we now will have monthly statements for our non-EFT members. So if a member is not enrolled in EFT, previously they used to get a coupon book. They used to have to rip out a coupon and send it in monthly. Now we're actually going to send them a monthly statement. So this alleviates all the issues with missing coupon books, missing coupon statements, whatever the case may be. We're going to send them a bill every month with an envelope in it. They can mail a check back to us and they can take care of that. And again, it'll include the single rate, more transparency in that as well. Another really cool thing that I wanted to mention about this, and I think this is more of a selling point than anything, is with this new billing system, in the past, if you recall when you signed a customer up for our electronic funds transfer, that EFT, they basically could have one bank account per household, which means that they got one $2 EFT discount on the household. Well, now with our new system, we have the ability where even if there's two people in a household and maybe they want to have their premiums withdrawn out of separate accounts, they can do that. And not only can they do that, but now moving forward, for all clients that are enrolled in EFT, instead of a $2 discount per household for EFT, they will now get a $2 per person discount for EFT, which means that household would be getting a $4 EFT discount if they're both enrolled in EFT. And that doesn't matter if it's out of the same bank account or out of separate. If they're both enrolled in EFT in that household, they would both get that discount. So that will increase the savings here. And it's only $2, but every $2 helps. So increase $2 EFT discount if they're both enrolled in EFT. All right, I know we talked earlier about the wellness extras for those UHIC plans that we offer, and I wanted to just provide this map here, which, for the majority of the United States, you'll see that our wellness extras, value-added services, you'll hear them referred to as both, majority of them are the dark blue states, which include, as you can see on the slide, Renew Active, which is that gym membership, but they also include all of these other things. So the Staying Sharp, the vision discounts provided by iMed, the Integra Dental discount, the 24/7 nurse line. So for the majority of the states, that's what you'll get. There's the teal states, which do not have the gym membership. So there's just a handful of those states, but they have the same benefits as the dark blue states, minus the gym membership. And then for the lone state of New York, the orange state there, you'll see they do have the gym membership, but they lose some of the other wellness extras. They only have the AARP Stay in Sharp and the 24/7 nurse line. So again, just wanted to put this up there so that you guys can see a comparison of what's available out there in the market. And then for the Renew Active gym membership, I just wanted to highlight here as well, basically what that is, if you're not aware. So for members that are enrolled in a plan that has the Renew Active gym memberships, they get access to an extensive network of gyms and fitness locations. There's actually over 25,000 different fitness locations that they can access, including some premium ones like Lifetime Fitness, which those of you who may not be familiar, those gyms can be really pricey, but they're included at no cost in this Renew Active program, which is very nice. And another cool thing is that they don't have to enroll in just one. So let's say maybe they play pickleball at one gym and then they go to another gym to walk and another gym to do classes. So they have 3 total gyms that they use in total. They can use this program 0 cost for all 3 gyms to enroll. So it's a huge cost savings for members when you're looking at, you know, your total client and what they're getting and the cost of their premium. This is something really to try to sell them on as well, because not only is there the cost of the premium, but there's also the cost savings that they can get all of these gym memberships at no cost to them, which is a huge benefit for the members. They also, as part of this Renew Active program, get access to a Fitbit community. It's not an actual Fitbit, but it's a Fitbit community which provides workout videos with varying styles and intensities, as well as challenges that they can participate in and discussion boards as well that they can partake in. It also allows members who need to bring an assistant with them. So if you have someone maybe that likes to go to the gym, but they need to bring along an assistant because maybe they're not able to do everything on their own, this allows them to join them at no cost as well. Not necessarily a friend or a family member, but if they need an assistant to work out with them, this would allow that as well. So just another thing to throw out there, a cool benefit that this program has. This slide I just wanted to show more so that you guys have resources if you need them. So this basically outlines all of the different value-added services or the wellness extras that we just looked at, and basically where you can go to get additional information or additional resources on them. So if you have questions on Renew Active, there's the resource. If you have questions on the nurse line, there's the phone number. So I just wanted to flash this up here on the screen just so you guys could see where you need to go if you have questions on something. All right. The next thing I just want to highlight real quick is the sales portal and the UHC toolkit. For those of you who are not familiar, we have these 2 great resources for our agents, and they both have different things, but tons of things that are useful to you. So the sales materials portal includes not only your state-specific enrollment kits and your producer handbooks, but it also includes some additional materials that you can maybe leave behind if you're visiting clients or things like that. There's a tons of things, and you can break it down by which state you're looking at, which product you're looking at. So it's very easy to use, and tons of things out there to make life easier for you guys. The other option we have is the UHC Agent Toolkit. So the UHC Agent Toolkit provides sales presentations. It provides some direct mail opportunities for those Elite A2O program folks. It includes some materials and flyers and things there as well, social media posts, a bunch of different things. So if you haven't visited either one of those options, I definitely would recommend just taking a look at them and seeing what's all included and what's out there for you guys. The next thing I want to highlight is the lean tool that we have. So what United Healthcare uses for our enrollment is our lean system. And some of the perks of the lean system, obviously it's all online, it's fully digital, which is nice. It also provides you real-time rate increase or real-time premium information. So if you have a client and you're going through the application and you're wanting to know what that premium is for that client, it's going to show you through each step of the way what that expected premium is for that client. So there's no guessing on what the premium is. There's no, wondering if, maybe I looked at the wrong book or I looked at the wrong rate or the wrong zip code. It's all going to be right there in lean real time, right for you to see, which is fantastic. Another huge perk of the lean tool is real-time underwriting. So if you have someone that has to go through the underwriting process, answer the health questions, we try to do as much as possible to real-time underwrite those applications and get you back answers within 2 minutes while you're on the lien application. Give you those application responses back. So whether they're accepted at the standard rate, whether they're level 2 rate, whether they're pending because maybe we need to get some additional information from the client or from a doctor, or whether they're denied, you'll get that information in real time, which means then it gives you as the agent the ability to then take next steps. If they were denied, to look at other coverage. If they were, rated up, is there maybe another option out there for them? Or, you can work with them to try to, if there's a pending application, see what's needed to complete that application as quickly as possible. Another thing that's used through the lien tool is our express security code. So applicants can quickly and easily sign their applications using a security code sent to their email address. This just simplifies the security of them signing a digital application. The enrollment kit delivery can all be done right online as well through email, through lien, which is another, it's a paper saving piece obviously, but it's easier for you as the agent, and it just makes things more seamless as well when you can deliver that electronically through the lien tool. And the last piece that is really cool through the lien tool as well, as you guys know, an AARP membership is required for enrollment in an AARP Medicare Supplement plan. And when you use the lien tool, you can either apply, renew, or just verify a member's AARP membership through the lien tool, which again, just hopefully streamlines things and makes it easier for you. All right, I wanted to highlight our A2O program. I really like this program because it's something that's available to all agents, and it's available regardless of what area or state you're located in. So we get asked from time to time, is there any incentives in our area? Is there anything that you can, any programs that you're offering at the moment? And the cool thing is the A2O program is always there, and it's this built-in incentive program that can be used by the agents to earn more money. So eligibility for the program is listed here. And one thing I want to call out is that we actually lowered the amount of eligible accepted AARP Medicare Supplement apps that you need to submit to qualify for this program. It used to be 30 apps during the calendar year, and that has been reduced to only 25 qualified applications. Or the other option that still stands out there as well is maintaining a book of 150 or more active AARP Medicare Supplement members. And the other thing I wanted to mention as well is the enhancement to the A2O program. So we offer trips as part of the incentive, but we also this year started offering the option where if you wanted to elect for a cash payment instead of a trip, you can do that as well, which again, just puts more money in your pocket, which is what we're trying to do here. I wanted to just talk through kind of the success of this program in case you're not familiar. So in 2023, we paid out over $1.9 million in cash awards, which is incredible. And the best news is this is actually up from the prior year, which is 1.6 million. And the trips that we are offered are also up year over year. In 2023, there were over 120 trips offered, which is 20% increase from the prior year. And like I mentioned, you now can not only earn these trips, but you could also convert those to cash if you'd like as well. So if you're not familiar with the A2O program, if you have additional questions, I definitely would recommend looking into that. It is a fantastic program. This slide, like I said, just really talks through you can earn cash, you can earn trips, and then you can also now convert those trips into additional cash, which is fantastic. All right, this last slide really just shows, again, our support staff that we have available to all of you in the field, as well as Rebecca Mest as our national director. But if you scan this code here on the screen, it will link you to all of the trainings that we have coming up throughout the United States, depending on where you're looking at, that are led by all of our regional sales directors, as well as anything else we have going on from our training team. So if you're looking on something that maybe I covered today, but you're looking to get a little more deep dive or a little more information on it, there's likely a webinar specific to that that you can go to that'll give you more information. Or as I mentioned at the beginning, There's email addresses here for these folks. If you have a question on something I mentioned, please feel free to shoot them a message and they'll be glad to answer that question as well. And with that, I would just like to say thank you guys for the time today. I know I went really fast, but I wanted to make sure that I stayed within the allotted time for you guys, didn't go over, and was able to cover as much as possible. So thank you guys very much. Are there any questions that anyone has that I didn't, kind of answer throughout the presentation that I can possibly answer now?
Hi, Greg. We just had a couple questions here. I'm not quite sure what this means. Can clients still move from Plan G to NLK with no underwriting? Oh, so plans K, L, or N, I'm assuming.
If they're downgrading within the same business entity, and when I say business entity, I mean as long as they're with, UHIC and they're staying with UHIC, if they're downgrading, yes, that would be correct. The only caveat to that is if they've been enrolled, and I don't have the date off the top of my head, but if they've been enrolled for quite a few years, there may be a caveat where they wouldn't be able to, but otherwise, in the majority of cases, yes, they would be able to downgrade.
And then we had one more. I'm just asking for a little, he was just asking, when is this expected to be in Colorado, available in Colorado? I'm not sure which part that was.
Do we know which program he's referring to?
I'm not quite sure on that. But could you also go over the difference between Renew Active and Silver Sneakers while I wait for a response back from him on the other?
Yeah, so, yep, no problem. So we used to offer Silver Sneakers, obviously, which some of you guys may know, and we actually transitioned over to Renew Active. Renew Active is, when it started out, it wasn't quite as large of a network. It wasn't quite as encompassing of a benefit as the Silver Sneakers, but over the years, it has morphed into a larger network. And it also has more benefits. Like I mentioned, you can have multiple gyms. There are an opportunity where you can refer a gym. If there's a gym in your area and it's not included, you can refer those gyms. So over the years, it actually has become, I feel, a better value than the Silver Sneakers. I know Silver Sneakers has that brand recognition where in the marketplace, you'll hear someone mention Silver Sneakers, but when you compare side by side and look at maybe what the gyms that the member is trying to attend, you're typically going to find that the Renew Active will meet or exceed all of their expectations for that.
Perfect. And so the question before was, when is this expected to be in Colorado? It was the dental vision hearing plan or program.
So I don't have an exact time I wish I could give you guys more details on that. I apologize. But like I mentioned, we are trying to aggressively expand that because it's going very well in the states that we have released it in so far, but I don't have any specific timelines that I can share. I apologize.
Okay. And then one other thing too, are the DVH plans commissionable? And do you waive the waiting periods on implants if they're coming off of an employer dental plan?
So they are commissionable. The commission is out in the commission amendments for those plans. And that is not waived, unfortunately, the implant, regardless of whether they're coming off an employer plan or another plan with United or whatever, it still would be the waiting period.
Okay, got it. And I think we have one last question so far, and it was, where can I find the new supplemental rates for Connecticut and Delaware? Susan was asking.
Those should be out in the commission amendments. The updated amendments were released, so those should be out there and available.
Okay. Very good. Susan, if you're not able to find those, just give your marketer here at Premier a call and we will work with you to get that for you. And then we had one other question here from Daryl, and he's asking, do they need to be on a UHC MedSup in order to add the DVH plan, or is it available for clients on other Medicare supplement plans that are not AARP?
Yep, that's a great question. We would prefer, obviously, if it was one of our plans, we would prefer they're partnered together, but it is not a requirement. You can enroll someone in whatever plan, and they can then enroll in our DVH plan. That it's not a requirement that they have the United Healthcare MedSup plan. It's also not a requirement for the dental vision hearing plans that they have an AARP Medicare supplement, or sorry, AARP membership. So they don't need the AARP membership and they don't need to be enrolled in our plan. anyone can enroll in that plan.
Perfect. And one other thing here, referring to the dental benefit, verifying that preventive services count to the max yearly carrier benefit. Is that right?
Yes.
Perfect. I think we blew through all the questions.
Okay.
That's a win.
Fantastic. Well, if anyone thinks of anything additional, like I mentioned, I shared all the email addresses for all of the regional directors. They'd be happy to answer any of the questions. Obviously, we have lots of resources out there as well online, but please feel free to reach out for any additional questions. We would be happy to help and answer those questions.
Very good. Thank you, everyone. We appreciate your time today, Greg.
No
Great.
problem. Thank you for having me. I appreciate it. I hope everyone has a great day.
You too.
Thanks. Bye-bye.
Bye-bye.